Have you ever heard of DiGeorge syndrome? Well, in this speech, I'll tell you about what it is, how you get it, signs and symptoms, and finally the life expectancy. I chose this topic because one of my cousins has DGS, and I wanted to know about it as well as inform other people because it is not very well known. What is DiGeorge syndrome? DiGeorge syndrome, also known as 22q11 syndrome, is a disorder caused when a small piece of chromosome 22 is missing. I wanted to know this part of chromosome 22 that is damaged has multiple genes that influence the growth of several body systems, which means the related organ systems will not develop normally. This syndrome is rare with only 200,000 cases per year in the US. DGS is also normally diagnosed before a child is born, but can be in early childhood. 6 to 10% is inherited from parents, 10% is associated with fetal alcoholism syndrome, mental diabetes, maternal diabetes, parental exposure to atropine and other chromosome defects. The other 80% is unknown. There is not a specific treatment for this condition, but symptoms can be managed. What are the symptoms? Signs and symptoms may vary by the severity of, depending on which body systems are impacted by the syndrome. This can develop later in infancy or early childhood, while some might be visible at birth. Some of the symptoms are frequent infections, undeveloped chin, low set ears, wide set eyes, a gap between the roof of the mouth, delayed growth, difficulty feeding, and failure to gain weight. Some of the bigger syndromes are heart defects that can result in insufficiency supply of oxygen-rich blood. Defects may include holes between the heart, one lower chamber, one large vessel rather than two leading out to the heart, and a combination of 4 heart structures that will be damaged. Hypoparathyroidism is where the 4 thyroid glands on the neck regulate the levels of calcium and phosphorus in the body. DGS may also cause problems with development, function in the brain and learning, social development, behavioral problems, delayed in the toddler's speech and learning difficulties are common. Some children develop ADHD or autism later in life, and they also have risk of depression, anxiety disorder, bipolar, and schizophrenia, shown in this graph by the ages. The effect of DGS is the same in the majority of patients, but they do not always present in the same way. Some patients of DGS might have severe cardiac anomalies, some have none at all, some have major learning disabilities, and some will have none. This means there's a wide spectrum of DGS how DGS will affect kids. Complete DGS is the most severe DGS with very bad prognosis, with less than 1% of patients will die in the first 12 months without a thymic cell transplant. Even with the transplant, a study showed infants who received a thymic transplant who have complete DGS, only 36 survived the first 2 years. I think that people should know more about information about different kinds of syndromes, but specifically DiGeorge syndrome. It is a syndrome that can be very different in every case, from very little symptoms where kids can live very full lives and healthy, to other kids that have had heart defects or need a cell transplant and still will die in the first 2 years of their life. DGS might be rare, but it doesn't mean it's not something that doesn't affect families all around the world.